Welcome back to Knowledge Park. Stop scrolling. In 1 minute, fertility will feel simple and irresistible. Why this matters. Timing calms chaos. Planning builds power. Knowledge quiets noise. Big picture. 2 designs in duet, built to sync and shine together. They don't compete, they converse, trading precise chemical love notes. Ovaries. A quiet vault, selecting 1 star each month, then cueing the lights. Fallopian tubes. Feather-soft fimbriae sweep up the egg, guiding the first hello. Uterus. The ultimate host. Building, checking, and soft landing a welcoming lining. Cervix. The gate with moods. Opening, closing, filtering, all on rhythm. Vagina. A protective, adaptive corridor. Strong, flexible, and ready. Mammary glands, lobules, and ducts. Estrogen and progesterone ready tissue. Prolactin crafts milk. Oxytocin lets it flow. Nourish body, bond hearts. Hormone overture. The brain sends follicle-stimulating hormone to wake follicles. Rising estrogen lifts the lining like fresh linen. Estrogen peaks. Then a luteinizing hormone surge cues ovulation. Spotlight on. After release, progesterone settles the room. Stable, receptive, quietly confident. Brain to ovary, ovary to brain. Feedback conducts a monthly symphony. Anti-Mullerian hormone is today's egg reserve snapshot, a planning guide, not a life score. Measured with a simple blood test. Use it with age and story to chart your path. Up next, the month, simplified. Signals, ovulation timing, and the first hello. Stay with me. Month, simplified. With smart timing, biology becomes power and play. Phase 1, follicular. After your period, follicle-stimulating hormone sends the invite. Follicles grow. One takes the lead and makes estrogen. Estrogen refreshes the uterine lining, soft, supple, and well-supplied. Phase 2, ovulation. Estrogen peaks, a luteinizing hormone surge cues. Ovulation, spotlight on. Feather-soft fimbriae sweep the star egg into the tube. The fertile window, about 5 days before ovulation, plus ovulation day. Your sweet spot. Phase 3, luteal. The emptied follicle becomes the corpus luteum, and progesterone sets a cozy, receptive mood. Progesterone shifts the lining to receptive and thickens cervical mucus. Signals in sync. Now the sperm journey. Vagina, cervix, uterus, tube, an upstream quest. Only the hardiest pass when mucus is stretchy. Gentle uterine waves help guide them. They capacitate, an internal tune-up for sleeker swimming, and a primed cap. At the egg, one binds the coat, releases enzymes, and slips inside. The egg blocks the rest. 2 nuclei meet, 1 ZIE goat. As it drifts, it divides. 2, 4, 8 cells, a compact embryo. By day 5, a blastocyst. It reaches the uterus, poised to attach. The bridge ahead, the window of implantation. Progesterone sets a short window, about days 6 to 10 after ovulation. Timing and signals must align. Recap. Follicle-stimulating hormone grows. Estrogen builds. Luteinizing hormone releases. Progesterone prepares. Sperm travel. 1 fertilizes. ZYE goat to blastocyst. Window opens. Next, implantation. How the lining and embryo whisper, and how clinicians time it. Stay with me. Handoff time. Fertilization glides toward implantation. Progesterone starts the clock. Days 6-10. Lining turns receptive. Signals glow. Integrins and LIF. Attach here. The implantation window. 3 steps. Apposition. Rest. Adhesion. Hold. Invasion. Guided entry. Miss the window, and even great embryos can't anchor. Clinicians' time transfers. Emergency room. A may help. Scratch is mixed. Individualize. Tolerance next. The embryo is part you, part new. The uterus chooses welcome. Uterine natural killer cells remodel arteries and guide trophoblasts. Steady flow. Regulatory T cells expand. Cooling conflict, keeping peace. Genetics matters. Maternal killer immunoglobulin-like receptors with fetal human leukocyte. Antigen C sets invasion depth. Some invite, others limit. When harmony fails, risks rise. Preeclampsia, growth restriction, miscarriage. When attachment holds, placenta leads, fetal tissue rooted within you. Hormone notes, human chorionic gonadotropin rescues progesterone, human placental lactogen shifts metabolism, placental corticotropin releasing hormone tunes vessels in stress. These rhythms give early clues, teams watch and adapt. Recap, time the window, attach in 3 steps, build tolerance, tune depth, placenta leads. Next, his side and molecular sparks, stay with me. Next, his side of the dance, strong design, subtle chemistry, testes make sperm and testosterone, epididymis matures, vas deferens delivers, clean, elegant logistics, erection simplified, NY trick OXID relaxes arteries, blood fills the corpora, veins compress to hold the lift. Accessory glands assist. Seminal vesicles add fructose and alkaline fluid. Prostate gels, then liquefies. Bulbourethral glands lubricate. Smart engineering. The scrotum runs cooler than core. Temperature protects quality. Spermatogenesis takes about 74 days. Choices today show up in 2 to 3 months. Sperm carry deoxyribonucleic acid plus epigenetic marks. Methylation dots and histone spools that set tone. Sleep deep. Eat colorful vegetables, fruits, and omega-3s. Move regularly. Skip smoking, excess alcohol, and toxins. Seminal fluid is bioactive. TGF-beta and prostaglandins signal the cervix and uterus after sex. These cues expand regulatory T cells, cooling friction, priming tolerance. When signals drift, implantation can stumble. Frontier spark, oligomycin sensitivity, conferring protein, can enter the egg's mitochondria, boosting early energy flow. When oligomycin sensitivity conferring protein is low or faulty, embryos may stall, an energy issue, not a gene flaw. Practical heat hygiene. No hot tubs, laptops off laps, breathable underwear, and review workplace exposures. Near the fertile window, regular ejaculation can refresh semen. Very long gaps may raise deoxyribonucleic acid damage for some. Start evaluation early. Semen analysis first. Then consider deoxyribonucleic acid fragmentation and emerging epigenetic assays. Ver eco seal is common and treatable. Big picture. Structure delivers. Molecules whisper. Care for the system, and it performs with confidence. Next, we stitch both sides together. Next, conditions and aging. Clear, kind, stigma-free guidance. Aging first. Telomeres, chromosome caps, shorten with time and stress. Foundations help. Steady sleep, joyful movement, nourishing meals. Some cells go senescent, stop dividing, and release inflammatory signals. In ovaries, that background buzz can nudge follicles and egg quality. Researchers are testing ways to quiet or clear senescent cells. Promising, not routine. Power matters. Eggs rely on healthy mitochondria for early divisions. Low energy can stall embryos. Early studies of patient-derived mitochondrial support exist. Intriguing, still investigational. Autophagy, cell recycling, keeps parts fresh. Aging and stress can blunt it. Teams explore lifestyle and targeted medicines to support quality control. Polycystic ovary syndrome mixes hormone and metabolism shifts. Many small follicles, less ovulation. Possible signs: irregular cycles, acne or hair changes, weight challenges, infertility. Insulin resistance can raise ovarian androgens and disrupt ovulation. Not your fault. And manageable. Start with nutrition, movement, sleep, tracking, and medicines when needed. Gut imbalances may fuel inflammation and insulin resistance, nudging brain hormone rhythms. Partner with your clinician. Endometriosis. Tissue like uterine lining grows outside the uterus, bleeding, inflammation, and pain. New vessels and nerves can heighten pain. Some lesions resist progesterone's calming signal. Symptoms include severe periods, pain with sex, bowel or bladder changes, or infertility. See a gynecology specialist. Tailored diagnosis and treatments can improve pain, function, and fertility. Infertility is medical, not identity. Causes include ovulation issues, blocked tubes, endometriosis, uterine factors, low count or motility, sperm deoxyribonucleic acid fragmentation, and more. Evaluation is team-based. History, exams, labs, imaging, semen analysis. Focused tests then guide action. Emergency care for severe pain or heavy bleeding. Early assessment opens options and eases the mind. Men's health. Benign prostatic hyperplasia can slow flow and raise nighttime trips. Treatable. Talk to a clinician. Prostate cancer screening is individualized. Discuss family history, risks, and when to check prostate-specific antigen. Cancer prevention and screening save lives. Practical, powerful care. Cervix health. Human papillomavirus vaccination protects. Pap and human papillomavirus tests find precancer early. Book it. Seek care for very painful, heavy, or irregular periods. 12 months trying. 6 if 35 plus. Pelvic pain, painful sex, urinary changes, unexplained bleeding or weight loss, fevers, or new lumps. You deserve respectful, evidence-based care. Ask early. More guidance next. Quick reset. Your choices tune biology. Ready for practical steps. Pillar 1. Colorful fruits, vegetables, and fiber. Vibrant plants steady insulin and shield deoxyribonucleic acid. Pillar 2. Silky fats. Olive oil, avocado, nuts, seeds, omega-3 fish, pamper membranes, and mitochondria. Pillar 3. Satisfying protein, eggs, fish, tofu or tempeh, beans, lentils, yogurt. Simple plate. Half plants, a quarter protein, a quarter smart carbs, plus a thumb of healthy fat. Dial down ultra-processed foods, sugar rushes, trans fats, excess alcohol, and smoking. Protect the vibe. Sexy swaps. Use glass or stainless for heat. Skip microwaving plastic. Go fragrance-free. Check BPA, BPS, and phthalates. Ventilate. Wear gloves. Wash or peel produce. Lower exposure, not your mood. Feed your microbiome. Fiber-rich plates and fermented foods. In the reproductive tract, lactobacillus dominance is beautifully receptive. Targeted probiotics and transplants tempt, but not DIY. Talk with your clinician first. Stress, softened. Slow diaphragmatic breaths with longer exhales. Micro-recovery. A stroll, a body scan, or one delicious song. Sleep is foreplay for hormones. Consistent times tune, gonadotropin-releasing hormone, follicle-stimulating hormone, luteinizing hormone, and testosterone. Move regularly. Add 2 to 3 strength days. Avoid extremes that starve energy or overheat desire. Heat and toxins kill the vibe. Skip hot tubs. Keep laptops off laps. Choose breathable underwear. And review workplace exposures. Future Teas. Artificial intelligence refines embryo selection, analyzes and sorts sperm, and personalizes stimulation. Frontiers. Mitochondrial support. Sun Essence and Auta Fuji tuning. Nuanced receptivity testing. Microbiome-based care. Recreational tetrahydrocannabinol can disrupt. Preserve potential. Freeze eggs, sperm, embryos, tissue banking advances. In vitro horizons grow. Ask about time-lapse, single embryo strategy, artificial intelligence tools, and receptivity testing. Weekly rhythm. Plan, prep, move most days. Guard sleep, make smart swaps, and track cycles or semen. Early evaluation opens options. Mindset, progress over perfect. Small habits, sexy biology. Like, share, subscribe, and ask away. Checklist recap. Function, produce offspring. Key organs, ovaries, tubes, uterus, cervix, vagina, mammary glands, testes, epididymis, prostate, penis. Physiology, gametes meet, fertilization in tube, embryo to uterus, implantation window. Disorders, polycystic ovary syndrome, endometriosis, infertility are manageable with early, evidence-based care. Your biology is brilliant. Feed it well and let it glow.